On the programme yesterday, we said that in their manifesto, Labour pledged that they wouldn't cut the international aid budget. Now, it has been cut by 40%, down from 0.5 to 0.3% of GDP, around £6 billion. But we would like to clarify that their manifesto says they're committed to restoring aid spending to 0.7% of gross national income as soon as fiscal circumstances allow. Just wanted to clear that up.
Yeah. Meanwhile, the government has announced it's rolling out a supervised toothbrushing programme for 3 to 5-year-olds in the most deprived areas of England to help protect them from tooth decay. Now, Care Minister Stephen Kinnock joins us live from Cardiff. Minister, you're making this announcement today. Obviously, kids' teeth are important. There are some people at home saying, yeah, this is the role of parents. You know, teachers are hard-pressed enough. Why is this important?
Well, hello, good morning. And one of the most shocking statistics that we have is that the biggest cause of 5 to 9-year-old children being admitted to hospital is to have their decaying teeth removed, often under general anaesthetic. That's a completely unacceptable position. So I'm really pleased that we are launching today our manifesto pledge to roll out supervised toothbrushing for 3 to 5-year-olds in deprived communities in the country. There's a very strong link between deprivation and tooth decay. But it's also really important to stress that this is a partnership. This is about early years educators and parents, and of course the children themselves, working together to improve their oral health. It's so important for a good start in life that you can smile with confidence, that you sleep well, that your studies are not affected by poor oral health. So what the children will be doing is a very short supervised toothbrushing in class, 3 to 5-year-olds, so it's not as if we're interrupting a history lesson or a maths lesson, and it's going to have really big impacts in terms of value for money for the taxpayer. Every pound invested will save £3 in the long term.
Yeah.
And of course, there's a very innovative partnership here with Colgate, 23 million toothbrushes and toothpaste as part of this deal, so it's very good value for taxpayer money as well.
Mr. Kinnock, I don't think anybody's going to say it's a bad thing that children know how to brush their teeth and have healthy teeth. Only the other day on the programme, we interviewed somebody that actually was in a coma, had to be into an induced coma because they had got an infection that had turned to sepsis from their tooth. Now, they were an adult who couldn't get an appointment. And one thing our viewers are very upset about is the dental deserts that we see across the country. The government announced 700,000 extra urgent dentist appointments. When are we going to see those? Because the Dental Association says even that's a drop in the ocean.
So the 700,000 will be rolled out from the 1st of April. Again, we've prioritised it on areas of the country with greatest unmet need, exactly as you say, in dental deserts. That's going to be a really important initiative. Of course, there's two sides to this. There's treatment and there's prevention, and the two feed off each other. And it's really important that you get the prevention agenda right. What we want is good oral health from the earliest years in a child's life, because they learn the habit of a lifetime, and that helps them in the long run, and it also stops having to have acute treatment. But I absolutely accept that the NHS dentistry contract is broken after 14 years of Tory neglect and incompetence, and we are in talks with the British Dental Association to do a radical overhaul of the NHS dentistry contract. It's a crazy situation where we have demand for NHS dentistry going through the roof, and yet an underspend in the NHS contract. So we've got to fix that. We're fixing with the 700,000. We're getting the prevention agenda moving. There's a lot more to do, but we've made some really big steps in the last few weeks and months.
So, of course you are. Thank you very much for that. Of course you are the Care Minister. And we know that very soon those national insurance increases are going to come in. The government's put aside for those running homes some extra money to manage the impact that will have on them. But today, the care industries is saying it's not enough. We're in trouble. The care home situation is bad enough anyway. We have a lack of carers that we can access, you know, a huge dearth of getting good staff or even staff at all in some cases. Were you happy that the government took this line to increase national insurance and make that burden even greater?
Well, of course, on the 4th of July, when we won the general election, we inherited public finances in their worst state since the Second World War. So the Chancellor had to take some necessary decisions about finding the funding to rebuild our public services, which are also on their knees after the Tory incompetence. So there's a lot to fix. I know that this is a very difficult set of decisions that have been made. I completely understand that. But of course, we have found £3.7 billion for
the
social
industry
care
says that's
authorities,
not enough, though. That's
including
the
an
problem.
Additional 880 million. Sorry, could you just say that again?
The problem is that the care sector at the moment, according to a number of people, is in what's called a social care doom loop. You know, I've got a dad in care. It is very, very difficult. The King's Fund have said that measures taken by Rachel Reeves in the budget, especially raising national insurance, is going to make things a lot worse. Now, the way to resolve this would be to have a carve-out for the care industry when it comes to national insurance and the workers that do so much to look after our ageing population and people who need care. Will this government commit to that?
Well, through the £3.7 billion for social care authorities and the additional £880 million social care grant, that is going to support local authorities in terms of commissioning adult social care
them from national
across
insurance.
the country.
Sorry, forgive me, Minister, it's not I'm interrupting you, it's just the question was about national insurance. Will you have a carve-out for care workers when it comes to national insurance?
Well, the raising of employers' national insurance that was announced at the budget in October was based on the Office for National Statistics definition of who should or shouldn't be paying employers' national insurance. So the Chancellor was simply complying with the ONS definitions, and that is the way we're going to move forward on this. But of course, we're also hitting the ground running in terms of a range of other reforms to support adult social care, including an £86 million uplift to the Disabled Facilities Grant, empowering care workers to do more basic health checks like blood pressure checks.
I hear that, but unless care workers can be adequately paid and unless we can afford them, unless homes can stay open and function, we're going to have a significant continued problem. But thank you very much, Minister, and I think you want to tell us all and tell our kids to brush our teeth, so we'll certainly be taking that into mind.
Good to speak to you this morning. Thank you very much indeed.